Welcome to Learning Thursdays. I'm Dean Hale with the OASAS Learning and Development Unit and your host for today's presentation. Today's presentation is titled Maximizing the Peer Role in Urban and Rural Environments. And joining me today are Brenda Harris-Collins, New York State OASAS Director of the Recovery Bureau, Mary Alice Ryan, New York State OASAS Statewide Peer Integration Coordinator, Sylvia Hart, New York State OASAS Statewide Peer Integration Specialist, Sally Coletti, Network Development and Engagement Specialist at South Central Behavioral Health Network, and Ashley Dixon, a Certified Recovery Peer Advocate. They'll be joining me in just a moment, but first a word about Learning Thursdays. Learning Thursdays are offered to behavioral health professionals as a free learning opportunity with the goal of improving the knowledge and skills of the New York State substance use disorder workforce as we strive to improve the lives of individuals needing prevention, treatment, recovery, and harm reduction services. A goal of Learning Thursdays is to support the professional development of the treatment, prevention, recovery, and harm reduction workforce. We do this by offering regular presentations that are relevant to today's substance use disorder treatment professional. As always, if there are any questions, comments, or suggestions, please feel free to contact us at the Learning Thursdays mailbox. You can use the same mailbox to express an interest in providing a future Learning Thursdays program. And now it's time to start the presentation and welcome our panel.
So good morning. It is a pleasure to be here with everyone on this Learning Thursday. And I think that you will find this a very important topic, maximizing peer roles, as we are seeing the need for peer recovery advocates and recovery addiction coaches everywhere that we have services and systems of care. So today you are going to be hearing a lot about the peer role and how to maximize that peer role. I'm going to begin talking specifically about recovery and community and how important recovery is in having individuals, family, and our institutions really transforming and including the peer, the recovery peer advocate into their systems, which then really impacts the whole community. Our goal is to impact not just the individual, the family, but the community where people recover within their communities. So today, listen and you will learn a lot about maximizing the peer role. And at this time, I'm going to turn it over to Mary Alice Ryan.
Hi, everyone. It's great to be here today. And as Brenda said, we'll be talking about defining the peer role. And we already have made introductions for everybody. So we really want to talk about what's important about the peer role is preventing peer drift, reducing stigma, and language matters. So we're going to define the peer role for you. Peer support is not, it's a program model. It is not focused on diagnoses or deficits. It's not about helping in a hierarchical way. So it's linear, it's not hierarchical. It's not about being a counselor. It's non-clinical. It's not about pressuring people to comply with treatment. And it is not monitoring people's behavior, and it is not care coordination or care management. So it's different than a clinical. It's very non-clinical, and it's a supportive relationship. So who is a peer? A certified peer specialist uses specialized knowledge and training experience to inform, motivate, guide, and support persons in recovery from a mental health diagnosis. And that is on the OMH side. A certified peer recovery advocate or provisional uses personal experience with substance use and training to provide non-clinical support services as identified in the patient's treatment or recovery plan. And a provisional is just like a certified recovery peer advocate, except they're going through their trainings. They just haven't sat for the exam yet. A CARC, which is called a certified addiction recovery coach, helps people create their own recovery plans and recovery pathways, helping customize plans and other supports that build on an individual's strengths, needs, and recovery goals. A CARC does not have to sit for an exam, and they are very similar to a CRPA. A veteran-supported support recovery is it's a peer specialty certification for professionals interested in offering specialized peer support to veterans. A criminal justice supported recovery, and this is new, and this is in addition to the CRPA certification, is a peer recovery specialized certification for professionals serving individuals with a history of involvement in the criminal legal system. And then I think I turn it over to Ashley.
So what is a peer engagement specialist? This is someone who supports individuals with struggles that pertain to mental health, psychological trauma, and/or substance use. The important thing here is that lived experiences offer expertise that professional training cannot replicate. Words matter. So when we're talking with peer engagement specialists and when we're working with people who are engaging in recovery or harm reduction, there are a lot of words that we are pushing past and moving away from so that we can more closely help and relate to the people that we're working with. On the screen, you'll see a list of words surrounded in red that we don't use anymore, right? Instead, we've started to use words like a person who uses drugs or a person who uses substances. We don't say drug abuse, we say substance misuse or even substance use. Abstinence is something that we may say as opposed to sober or clean, somebody who's not actively using. If somebody is actively using, we can say that they're actively using. And of course, we move away from terms like relapse and go back to reoccurrence, sometimes willful use for people who are choosing to engage in harm reduction as opposed to abstinence. We also talk about medication-assisted recovery, which can also be called medication-supported recovery, depending on who your trainer is. And of course, people who are actively in recovery are called person or people in recovery.
So there's a peer feedback cycle, and most important is the feedback that the peer is getting from who they're working with, and then more importantly, then they give feedback back to that peer, then they give feedback to the rest of the cycle. So they plan to receive feedback, they prepare to receive feedback, they present the facts, they exchange the feedback, whether it's in either direction, they're processing the feedback, they're acting on the feedback, and they're acting on the feedback. Peer support philosophy and values. Peer support is recovery oriented. It's voluntary. So the participant does not have to engage. It's always a choice for them. It's person-centered. It's relationship focused, and it's trauma informed. So we try to have it be all those 5 things to make the best relationship for the peer and the participant.
I'm going to turn this slide over to Brenda Harris Collins.
So today, the Certified Recovery Peer Advocate, we have been working with a lot of providers and addressing hiring, onboarding, and retention. Many struggle with how do we find peers? Where do we get them from? You've talked about these Certified Recovery Peer Advocates. They are billable peers, so all of our outpatient programs and OTPs should have a peer working for them. They work in recovery centers, they work in court systems, but where do you find them? So this particular slide begins to show you the different ways that you can find peers and help with onboarding issues and retention. So with recruitment, we have many sites that can assist you where you can post your position. So the OASAS Alumni Association, actually that's with For New York. You can go to the For New York website and you can click on the Alumni Association Job Bank and post for positions there. ASAP and Unity Alliance, New York's Certification Board is also a resource, as well as their job bank, the Unity Alliance Job Bank. There's an organization, Path to Jobs, that's available that recruits individuals that are seeking to become SERPAs. They help educate them, get them passing their exams, and then also help to connect them to jobs. OASAS recovery centers. We're really moving towards the recovery centers becoming the hub of finding peers, but many of our recovery centers do the trainings. They have learning collaboratives. You can contact any one of the 31 recovery centers in New York State, and they can also assist in identifying individuals who are looking for positions, as well as contacting the New York State OASAS peer integration team at peer.integration@oasas.ny.gov. Also, onboarding. There are many tools that you can use. Peer integration toolkit, which you can find on the New York State OASAS website. And it really walks an organization through the stages of change in which they can identify what stage of change you are in. And based upon the stage of change, some of the tools that you need to integrate peers into your setting. For New York has training resources. Again, here we are at the OASAS Learning Thursday, and there are approximately 3 other Learning Thursdays that speak specifically to peers. Recovery Coach University, Roads to Recovery, Healthy Capital District, Recoveries R Us are also places that training happens, and they can also guide you through what that role looks like and help answer some of your questions. And we are really working towards building the peer workforce. The commissioner of OASAS has really asked us to do that, and as a result, we have scholarships. There are SERPA scholarships that are available through 3 organizations that offer them. The organizations are Exponents, ADAC, and Helio offers free scholarships, but there's also scholarships offered through Friends of Recovery New York. The scholarships, please go to their website and you should be able to identify how to obtain these scholarships. Retaining peers. So as we talk about maximizing the peers, you will hear ideas about retention and how to retain them. It is something that we have to, in talking about the values of being trauma-informed and person-centered, we also have to be trauma-informed and person-centered with our workforce. And so there are learning collaboratives that are available for supervisors as well as for recovery peer advocates, as well as CARCs. There's wellness action, recovery action plan that is available. Any support, there's a New York City Peer Recovery Coach Network. There is, again, the peer integration team, peer.integration@oasas.ny.gov also can give you. We also are right now doing a New York City peer learning collaborative with the New York City Department of Health and Mental Hygiene, really trying to help providers understand what is needed to retain the peers once you get them. But we know that this is an area of struggle and really a focus for us at this time.
Professional peer supervision. It is performed by an experienced peer provider or treatment provider. It can take place individually or in groups. Supervision training, recovery principle, SUD competency, Appendix 3. The supervisor provide a mutual safety, encouragement, balance, discipline, equity, and empathy. The Tip 64 have a great information about roles that a professional peer that you can do during a professional peer supervision. The supervisor provide adequate, create boundaries for the peers. They provide motivational interviewing and support the peer role. They encourage the SUD principle of care. The path to certification. There are various ways to get a certification. Decide which certification you would like to have. The CARC. The CARC is a certified addiction recovery coach. A recovery coach is those who are certified in addiction recovery, and recovery plays multiple roles, including that of an advocate, mentoring, education, and provides the support of those in the pathways to recovery. A CRPA. A CRPA is a recovery peer advocate. It is billable and can work in billable settings and non-billable settings. The CRPA uses personal experience with substance use and training to provide non-clinical support services. A CRPA provisional are also billable. They can upgrade by taking the ICRC examination to become a CRPA. Family. To become a family CRPA, you already have to have your CRPA, and then you take some other training hours to become a family CRPA, and they are also billable. The youth is an age limit with the youth. They can't be over the age of 30, and they also take additional trainings along with having the CRPA. They have lived experience as well. The CJSR is the Criminal Justice Supportive Recovery, which is advanced certification. You must be a CRPA and not a CRPA P. You must have a high school diploma, 6 months experience in a correction environment, the job working, 20 hours training in order to take the training for the CJSR, the Criminal Justice Supportive Recovery. Veteran Supportive Recovery, they work with veterans. They have lived experience as well. The PPS is the Professional Peer Supervisor Certification. Once you completed all this, you will go to step 2. You will have your training. Step 3, you will apply. Step 3.5 is optional. You can upgrade to other certifications to obtain the ones we just discussed. And step 4 is renewal. Every 3 years, you have to take training hours to renew in order to maintain your CRPA. Is it CRPA P, family, or youth? Once this is completed, hello, I am a peer recovery professional. What is a CRPA? A CRPA provides outreach, advocacy, mentoring, and recovery support services to those who are seeking or sustaining recovery. A CRPA applicant must pass the International Certification and Reciprocity Consortium, an exam offered by OASAS-approved professional testing company. They must hold a high school diploma or jurisdiction certification high school equivalency and complete 50 hours of required training, advocacy, mentoring, and education, recovery and wellness ethical responsibilities. Complete 500 hours of volunteer or paid role experience. They must receive 25 hours of supervision by the organization documented supervisory staff. They must pass the IC and RC peer recovery exam. That's how you go to about being a certification. Those are the certification requirements to become a CRPA.
Peer services for those with gambling lived experience. So we are in the process, New York State OASAS is in the process of looking at the provision of peer services for those with gambling lived for those with gambling lived experience. We are in the process of developing a gambling certificate for those with lived experience in collaboration with the New York Council for Problem Gambling. There will be a free training, which will be based on Oregon's core competencies specific to gambling. The anticipated completion date and availability date will be late fall, early winter. OASAS is conducting right now a needs assessment and recovery community outreach centers statewide to incorporate peer support services for those affected by gambling harms. So this is something to come for and to begin to look at and see when this happens. And we really are looking for those certified recovery peer advocates and CARCs that have gambling lived experience, because for this particular gambling certificate, it will not be a CRPA G, it's just a gambling certificate. You will need to have gambling lived experience. So we're looking forward to how we are really transforming our system, especially for problem gambling recovery. And we are excited about the new steps that we are taking. No course classes. Again, we were talking about scholarships. As we mentioned previously, that this is an effort to increase our peer workforce. And we are really looking forward to those who are interested in having this as a career, moving into becoming a peer. So there are scholarships that are available, and we mentioned it before. There are 3 providers that are providing CRPA scholarships. They are also doing CASAC, but we are highlighting the CRPA scholarships. And again, that is Exponents, Helio Health, ADAC, which is Alcohol and Drug Awareness Council. You can go to the OASAS website. You will find a flyer and ways to contact these providers for these CRPA scholarships. We spoke in regards to for New York and their scholarship program. For New York's scholarship program is very unique, as they cover everything. They cover the training fee, they cover the exam fee, they cover application fee, there are stipends that are available in all of these. For Helio, Exponents, and ADAC offers paid stipend for 25 hours of your towards your 500 hours of training that with supervision that is needed, a work experience with supervision that's needed. Friends of Recovery actually covers the whole 500 hours of stipend for that work experience time. And so these are very important. And one of the things that we want to do is get this information out so that we can build our workforce. And then Sally.
Hello. So in contrast, what our South Central Behavioral Health Network, which is based in Portland, did is we invested funds into our training program to meet our mission of providing a barrier-free, no-cost training to those CRPAs who are now certified and need to maintain their renewal, and they need to maintain their certifications. So we are providing 21 of those 28 hours free, no cost, and we do not have a scholarship program. It's simply a first come, first serve, sign up, on an easy to fill out registration form that lives on our webpage. We do hope that we will be able to continue these trainings in the next few years and offering more of very unique, innovative trainings not seen elsewhere. Thank you.
So what is it exactly that our peers are doing in the workplace? Certainly, there is to some extent documentation when we are working with individuals, but it's more than that and still different from the clinical side that we are so familiar with already. There's a different set of protocols, a different set of standards that are still very rigorous that we are held to as peers. We often have MOUs, memorandums of understanding, with other organizations so that we can refer people to the resources that they are seeking, right? We are not just creating recovery plans with people that are focused on substance use abstinence or harm reduction, we are creating new life plans as people are making massive behavioral changes within their lives. So often we have resources that are outside of clinical treatment, even within substance use. So what we might have is agreements with local agencies that can help with housing, that can help with food security, that can help with all of these things. So we have a lot of those going on within our agencies and within the places that peers exist. For documentation, I will be turning that over to OASAS to speak more detail on. But when it comes to protocols and standards, we do have the IC and RC exam, which is a national exam that is recognized as holding us to testing our knowledge and holding us to these standards of practice, as well as the In Unity New York Certification Board Code of Ethics that we all stand by.
So with documentation and recovery plans, as has been mentioned also previously, developing a recovery plan is a part of the work that a peer advocate does with an individual. And each person owns their own recovery plan. It is not something, it's not a treatment plan. It's not meeting somebody else's domains. It is meeting what that person wants to see, what that person wants as a part of their recovery process. And that will be where the individual can work with the certified recovery peer advocate or CARC to build that pathway to get to their goal. Documentation, there are also peer notes that are required when you're working in a billable service that peers have to complete. You can look back at that peer integration toolkit. It will give you some information about how to complete documentation, looking at SMART, to be able to complete it, making it specific and making it very clear about what took place. But peer notes are not clinical notes, and they are not related to diagnosis or anything like that, but is related to what has taken place and how you help that person meet the recovery plan goals. Documentation for existing clients. A progress note is needed in the chart whenever the peer meets with the client. One note will suffice for the entire session, whether it's 15 minutes or 60 minutes. The documentation should answer 2 questions. What did the peer do? How did this help to engage the individual thinking about moving towards a recovery goal, as we just spoke to? A peer services goal must be included in the patient's treatment recovery plan or discharge plan if services provided within a detox or another level of care. Peer services protocols provide structure for the relationship. OASAS, outpatient, and OTPs may bill Medicaid again for peer support services.
So where are we going to see professional peers working in environments around the state? We're certainly going to see peers employed with substance use disorder and mental health treatment locations, certainly emergency departments, crisis intervention teams, as well as clinical, residential, and treatment court areas. But we're also going to see peers existing in the recovery community, in the recovery outreach centers, as well as partnered with overdose prevention teams, street outreach, shelters, and sometimes even libraries, colleges, places where people in recovery exist, which, as we know, is everywhere. We're also starting to see peers come into prisons and jails across the state to work on creating an atmosphere of recovery within those institutions.
So we come to thank everybody for being on this presentation, this Learning Thursday, regarding maximizing the peer role. We hope that you have learned something and have found some resources or some ideas that will help you in really utilizing, incorporating peers into your services finding ways to support the peers that are working, professional peers that are working in your environment, and understanding that there is increasing needs. And as a result of the increasing needs for the peer advocate, professional peer advocate, there are increasing needs for us to find ways to support. And that's through scholarships, it's through helping us not lose our peers and be able to help them with their renewals. So we really are working hard to find ways to really expand our workforce to include those who need to incorporate it into their systems. We're grateful for this peer explosion, professional peer explosion that is happening because, and we are grateful to those who work in this field and will find and really working towards building at some point a career ladder, because this is a professional peer lane that has a purpose. And we see that even through COVID, that it was the professional peers that were still at the forefront, still moving and helping individuals who had needs when things were closed down. So we know the value, there is a value, and we wanted to just help you to maximize this value that is so needed at this time. And so we thank you for attending this Learning Thursday.
I want to thank all of my guests for joining me today. I hope you all find it useful while assisting clients in need of services. Your feedback is important to us. It helps us to know if we are meeting your educational goals and expectations. Once you have viewed the presentation in its entirety and completed the quiz, if prompted, please follow directions to access the SurveyMonkey website and take a moment to complete the evaluation, including suggesting any future topics for Learning Thursdays. Once again, thank you for joining us and keep up the good work.